Welcome back to Feel Good Friday. Associates in Pediatric Therapy. It's all about the patient of the month. It's a very inspiring story. This handsome young man right here is Samuel. A little applause for Samuel, ladies and gentlemen. Yes, he is our patient of the month. Before we get into Samuel's story, and this, by the way, is his mom, Courtney. Yes. Welcome to the show, Courtney.
Thank you.
Renee Sagasar is with us. And Renee, if you would, Associates in Pediatric Therapy. Tell us a little bit about your mission.
Yep. So our mission is to help children of all ages. 0 to 21 is our main focus, but speech, therapy, physical, and occupational, that's our mission, and we believe every child can make progress and succeed. So we love being able to help these sweet babies and do what we love every day.
All right.
So.
Well, let's, Courtney, tell me a little bit about Samuel's story and your experience as a mom and the progress that you've seen.
Yes. Samuel was diagnosed with spinal muscular atrophy, SMA number 1, shortly before his 8th month of life. And it kind of caught us off guard, to be honest, because we didn't have any signs of it in our family on either side. And so after diagnosis, we quickly started therapy services with Associates in Pediatric Therapy, along with First Steps, in conjunction with his new regimen of medication called Spinraza, which was FDA approved in December of 2016 as the only medication available to treat individuals with SMA.
Okay, now, Audrey, you're his physical therapist. Audrey Harsh, by the way. Audrey, welcome to the show.
Thank you.
Okay, so tell me the kind of, I guess, exercises, things that you do with Samuel, and what kind of improvement have you seen?
Awesome. So with Sam, we work on rolling over, we work on spending time on our stomach, and now we're moving into bearing weight. We use the therapy ball for that, and then we've been using the stander over the last couple weeks to try to get some weight bearing through his legs.
Audrey, I have to tell you, okay, so I was reading the little bio that you wrote. They say you're wonderful.
Oh, well, thanks.
Yeah, isn't that nice, though, to hear? That's got to be rewarding because, you know, when you're a physical therapist or a speech therapist, a very special relationship, and it becomes very personal.
It does.
So tell me a little bit about Samuel's personality.
So Sam is a total heartbreaker. I'm not sure how we get anything done because he's so cute, but we have a blast. He will work hard and play with whatever toys, but especially loves bubbles. That's a huge motivator for him. So we work on that together. He is always smiling, and family is willing to try anything and push towards their goals.
As a dad, when my sons would achieve any goal, you feel the sense of pride.
Yes.
So Courtney, tell me about some of those pride moments when you puff out your chest and you go, I am so proud of Samuel. Tell me about those.
Well, to be honest with you, every day we have small victories, and we celebrate them, of course, every day. But just anything as small as when he's reached up to grab toys, patting, rubbing, working on his rolls. We just recently did some play in the pool on vacation, and to see him swim and move his legs and his arms in the water was thrilling. But just even the smallest movements that many times are taken for granted are such a big deal with these kids that are dealing with this disease. And so we're excited to see him do anything and everything every day.
I know you're proud of him. I can tell.
Yes.
And I don't blame you. And by the way, with the Louisville International Festival of Film here, if there's ever a role for cute baby, Samuel, you're the winner. You don't even have to show up to audition. You're the cutest little guy. Tell me a little bit about the network. I think it's important. You know, we talk about it takes a village, and I know it's a cliche, but with Associates in Pediatric Therapy, you have a lot of tentacles. Renee, tell us about that.
So we have a variety of locations, and we have a lot of partners. So we partner with places like Down Syndrome Louisville, Sproutlings, the Kids Club, and we love our partnerships. Carriage House, he's shaking his head yes. We love these partnerships because we're able to help them connect and get the service that they need for their patients. We've also just recently expanded our Crestwood office. Our Bullitt County new office opened this week, and then we are now on Dixie Highway, which has been a huge need. So we opened Dixie a few months ago, and it's just been a blessing to be able to reach the community in different areas and not just be in one location. So we've been very excited, and we just this month celebrated our 11th year.
Congratulations.
I know.
You know, it's easy on the show for me to recognize when people are authentic and passionate about what they do, and I know you are. Audrey, I know you are as well. In the short time that we've known each other right here on set, I can tell that you really love what you do. It has to be rewarding to change little boys, little girls' lives.
It really is. It really is. It's a privilege every day to work with these kids and families.
Okay, Mom, before we go,
yes,
I want you to tell us about Samuel's Facebook page.
Yes, yes. We have a public Facebook page called Samuel's Miracle in Action, and it's a way for us to reach everyone that we can possibly reach to talk about SMA, spinal muscular atrophy, to promote everything that's groundbreaking and earth-shattering that's happening in the area of this such devastating disease, and just to talk about it so more people understand what it is and know more about it. That's my goal. Because, like I said, just 5 months ago, I didn't even know what this disease was or what it entailed, and so that's what I'm trying to do with the page. And so I invite everyone to like the page and to read our posts and watch his progress and all of his therapy with Audrey and our other therapist Amy, and our therapy team is wonderful, and it's just a way for us to build relationships and break through ceilings.
All right. Once again, Associates in Pediatric Therapy. Okay, come